Good morning. Tooth loss has been a common problem since ages, and dentistry has come up with a number of prosthetic solutions for the same. Fixed partial dentures has been one of the most popular ways or solutions for this problem. So today we'll be talking about Pontics, one of the components of fixed partial denture. We will be covering this under the following headings: introduction, definition, clinical assessment, classification, design considerations, followed by the conclusion and a small questionnaire. So what are we going to understand in this topic? The what, the why, and the how. So what is a Pontic? Why do we need different designs? And how do we choose a Pontic clinically? So first let us have a look at the components of FPD. The basic components of FPD are retainer, Pontic, and connector. And today we will be talking about Pontic. So what is a Pontic? A Pontic is an artificial tooth of the fixed prosthesis which replaces the missing natural tooth and restores its function and fills the space previously occupied by the missing clinical crown. So this is how it is. It is basically that component which replaces the missing tooth. What are the functions? Mastication, speech, and aesthetics. Mastication being one of the key components or key functions of this component. So what do we see or consider during designing this component? So there are three main factors: the biological, the mechanical, and the aesthetic. Under biological, we need to consider the cleansability of the tissue surface, the access to the abutment teeth, and the pressure that is applied on the ridge. When we talk about mechanical, we need to consider the strength of the component, the connectors, as well as the metal ceramic framework, the strength of the framework to resist deformation. And when we're talking about aesthetics, it is how natural this component appears to replace the missing tooth. So it should look like the tooth it replaces. It should appear to come out or emerge from the gingiva like a natural tooth, and there should be sufficient space for the porcelain in order to match the aesthetics with the remaining natural teeth. Clinical assessment. So what exactly do we see when we are designing a Pontic? We check for the Pontic space, whether it is adequate or not. We check whether this tooth lies in the aesthetic or in the non-aesthetic zone. We check for the residual ridge contour, and we check for the gingival architecture, whether it permits good control over the aesthetics or not, or we need to correct it before going ahead with the prosthesis. Coming to the classification, so there are three main classifications for this component. First is according to the mucosal contact. The second is according to the materials used for fabrication, and third is according to the method used for fabrication. So let us just see these. First, according to the mucosal contact. So depending on whether this component touches the ridge or not, it is classified as mucosal and non-mucosal type. So the mucosal type has the following, that is ridge lap, modified ridge lap, ovate and conical. Whereas the non-mucosal type has two types, that is sanitary and modified sanitary. So the picture here clearly depicts how the different designs are. Let us see them a little bit more in detail. So the first type is the ridge lap or the saddle type of Pontic. So as the name suggests, saddle type means it is covering the ridge from both the sides, just like the saddle of a horse. So here it is completely covering the ridge. This was the most primitive or the first type of design that was introduced. So this is generally indicated in the aesthetic zone or the anterior zone, so that the black triangles or the gaps between the gingiva are not seen. It is contraindicated in the posterior region because it becomes difficult to clean or maintain hygiene when we use this Pontic. So here if we see the cross section, as we said, it is a saddle type. So it is completely covering the ridge. Now because of the complete coverage, what happens is that there is no access for hygiene in this area, which leads to chronic inflammation that happens below. As we can see in the pictures, when the prosthesis was removed, it was seen that there's constant inflammation that keeps happening under the Pontic, and this is not a good sign. So we came across the second design. The second design is the modified ridge lap. The modified ridge lap is just a modification of the ridge lap. That is, here we have modified the contact. Instead of it being throughout the ridge, it is just limited to the buccal area. So this is one of the most common advocated designs because it fulfills both the functions, that is aesthetics as well as maintaining hygiene. So if we have a look at the cross section of this Pontic, you can see that the contact is now limited to a T-shaped and it is no longer covering the entire ridge like we saw with the saddle type, that is the ridge lap. Next is the ovate Pontic. So here, this as the name suggests, it is oval in form and it actually appears like a tooth emerging from the gingiva. So it gives a very natural appearance. So this is generally advocated in the anterior zone where aesthetics is very important. However, it is important that this kind of a Pontic needs to be pre-planned. That is, on the day of surgery, we should be ready and have the plan ready so that we can execute this kind of a Pontic. It is contraindicated in the posterior region because again, access to the ridge under the Pontic is going to be very difficult. So maintaining hygiene is difficult. So here as we see, this is a planned case for ovate Pontic. So what was done is on the day of the surgery itself, when the tooth was extracted, the temporary crown or the temporary bridge was ready and seated on the same day. So as the healing of the socket takes place, it heals around the temporary, giving the site the appearance of a natural tooth, as in the site heals around the temporary, and so when we restore it with the final prosthesis, the tooth appears to emerge from the gingiva. So this is a ovate Pontic. Next is the conical Pontic. So conical Pontic, as the name suggests, is conical in shape. As we can see, it is having a pinpoint contact on the ridge down. So this is generally indicated in cases of posterior teeth where maintaining hygiene is very important. It does not give good aesthetics because as we can see there are gaps that are remaining around the gingiva. So this is generally not advocated in case of anterior zone. Next is the sanitary Pontic. So this is generally advocated again in the posterior region. As you can see, the shape is such that there is a gap that is left in between the ridge and the mucosa. So this is around 2 to 3 mm and it facilitates easy cleaning or hygiene in that area. So generally this kind of Pontic is given in the posterior zone where it is easy to maintain the hygiene and clean this area. However, the aesthetics are affected, so we do not indicate this in case of the anterior zone. Next is the modified sanitary Pontic. So this is similar to the sanitary Pontic, only that the surface, the underlying surface, the surface close to the ridge is having a concave shape instead of a convex shape. This is done generally when the interridge distance, that is the space for the Pontic, is insufficient. So here, in order to maintain the space for cleansability as well as to maintain the height of the connectors and the strength of the connectors, we need to modify the design in such a manner. So if like we can see, the picture here shows us both, that is the sanitary Pontic as well as the modified sanitary. This is a summary of the first classification, that is according to the designs of the Pontics. As you can clearly see, all the designs have been shown. Their indications, contraindications, advantages and disadvantages all have been mentioned. Focusing on the important part is that first, let us just summarize it in short. Sanitary Pontic is generally advocated in the posterior region where hygiene is very important. Saddle or ridge lap type is not recommended anymore because of the chronic inflammation that it leads to due to the continuous pressure on the ridge below. Conical Pontic, again, it is advocated in the posterior region because it does not offer good aesthetics. Modified ridge lap, it is one of the most commonly advocated designs because it gives us both the functions, that is, it fulfills aesthetics as well as maintaining hygiene. And the ovate Pontic, so this is generally indicated in the anterior region where we want to give a very natural appearance to the crown. However, this needs to be pre-planned. Coming to the second classification, the second classification is depending on the materials that are used for the fabrication of the Pontic. That is, it could be all metal, it could be all ceramic, it could be metal and ceramic, or it could be a combination of metal and resin. Let us just have a look. So all metal means here there is no ceramic involved, completely in metal. Metal ceramic, a combination of metal covered by ceramic. All ceramic, it is completely made of ceramic. And resin veneered Pontics means a layer of acrylic or resin is veneered on the surface of these Pontics. And this is fiber reinforced composite resin generally used in the anterior zone. That is where a fiber band is used to keep the Pontic in place. Now coming to the summary of this, here the second classification has been summarized very well depending on the material that is used for the fabrication, right? So coming to the important part, the metal ceramic combination or the material that is used is the most popular used because it fulfills both the functions, that is the strength of metal as well as the aesthetics of ceramic. So this is most commonly used whether it is anterior or posterior zone in both the areas. Next is all metal. All metal is generally known for its good strength and it is advocated in posterior areas where aesthetics is not a concern. This is the most conservative type of preparation it needs, and so it is generally advocated in the posterior region. Fiber reinforced resin, that is a fiber band, is eluted on the palatal or the lingual side, with the support of which we have the pontic in place. This is generally used in the anterior areas where the stress is very limited because it cannot withstand high strength, and this is generally used for temporary purposes or the purpose of splinting. And finally, the resin veneered or the acrylic veneered Pontic. This is also not very commonly used because the bond between the acrylic and the metal is not very strong, and due to this reason, it is limited in clinical use. Third is depending on the method of fabrication. So whether it is prefabricated, that is already fabricated, or it is custom made. So this picture very clearly shows us that is, if it is custom made, that means it is made using a wax pattern which is customized and designed as per our requirement. And if it is prefabricated, that means they are already fabricated and available in standard sizes. We need to modify them as per our requirement, and accordingly they have been used depending on the clinical situation. Pontic selection also depends on a very important criteria, that is whether the region is anterior or posterior. So as we know that anterior region, the aesthetics plays a very important role, whereas in the posterior area it is the strength and the hygiene which is most important. The anterior area generally is the area with less stress, but it is visible, and so aesthetics plays a very important role here, whereas in the posterior area the strength, that force of mastication needs to be taken into consideration, and so the criteria for selecting the design varies when the tooth lies in the anterior region or the posterior region. So this is the anterior pontic area. Here aesthetics is given prime importance, whereas this is for the posterior region where hygiene is given most importance. So coming to the end of the topic, the take-home message here is that the design of the Pontic plays a very important role in the prognosis of the entire prosthesis. And how well this design allows us to maintain a hygiene or plaque control determines the success or the longevity of the prosthesis. And so it is very important that we know the different designs, their applications, their significance, and accordingly choose the right Pontic design for the clinical situation that we are in. A small questionnaire regarding the most commonly asked questions related to this topic. These are my references. So ending with a good thought, I hope I have been able to simplify this topic. Thank you.